Hey guys! My God! Natatawa naman ako. Seryoso. Sinubukan ko uli. Sinubukan ko ng at this time. So, we'll see. Kaloka. Kaloka si Jubes. Nag-appear ba agad? Jubes, nag-appear agad? Subukan natin ng alas 7. My God. Do you even go to sleep? Kakatapos ko lang maligo. Actually, kagigising ko lang. My hair still wet. So, anong tawag dito? Pupunta ka ngayon sa sa Kalapan. Ay, sa Kalapan. Sa bangko. O mamaya pa. Uy, parang ang ganda naman ng camera na to. Yeah, so I just finished taking a shower and it's good. So guys, ask me questions related to I don't know, Finasteride, I guess, because I didn't have time to I didn't have a chance to answer some questions last week. But yeah. Mamaya mga 8. Ano ba oras na? 7:41. Tatry lang natin, Oh, I'm sorry. I cannot I can speak English, of course. It's just that Jube, one of the lady, she's she's speaking to me in Filipino, so I have to speak in Filipino, right? Yeah. Hi. Welcome. Are you Japanese? I love Japanese thing. I wanted to go to Japan. I wanted to go to your country. I'm planning to go next year actually. I love Japanese skincare. And oh, you're not. But your name is in Japanese. So what's your background? Ah, you're learning Japanese. Oh, nice. Yeah, I love Japanese language too. It's just that I wanted to learn Japanese too. The only thing is um I mean, there's really no way I can use it here in Canada, right? So, and also I have a lot of Japanese friends. So, this YouTube actually, I was planning to speak in Filipino, but I've decided to just speak in in English. So, in that case, a lot of my friends can also understand, right? But anyways, it's good that you're learning Japanese. Japanese is a beautiful language. I love Japanese products like skincare. Um, I also watch some Japanese movies like Studio Ghibli. I love Studio Ghibli movies, and I've watched a lot of them. But anyways, nice meeting you. What's your name, by the way? Tagalog is two. Oh, you're learning Tagalog too? Oh, yeah. Tagalog is good. It's just that it's kind of difficult sometimes. Even for myself, I mean, um, Romanji, Daichan in Romanji. Romaji. Okay. What's your name? Daichan? How did you find this channel? Are you into skincare and hair care and stuff like that? Nice. I'm actually doing some content with hair care, hair loss, because I did have some hair thinning before. So I'm kind of doing an update on finasteride because I'm using finasteride. It's a medication for hair loss, and also I do give some nursing advices too. I'm a nurse working here, so some skincare, like skincare related in nursing, I do show it in my YouTube. Just to help people also, and I wanted to help other people also in related to their hair loss. Especially a lot of guys are losing hair at an early stage, so they take the. I tell them to get to see a doctor and get the medication, the finasteride. So I'm just sharing with them my experience with finasteride, and a lot of the people actually um, wanted to know about the side effect of the medication because this medication is actually pretty scary for most of us, for a lot of the guys who wanted to use finasteride. Even for myself, I find it very scary to take the finasteride at first because there's a lot of side effects with taking these medications, but it's a pretty safe medication, and I used it and my hair actually improved a lot. By the way, don't mind, I'm eating my dinner right now. So what's your background, if you don't mind me asking? Hoy, Jubes, nandyan ka pa? Oh yeah, you've been on Fiance for 3 months, so I want you to share your experience with me. How did you? I mean, I've been with Finasteride for 2 years now. For 2 years, and let me tell you, it's really, really good. I encourage guys, especially at an early stage of hair loss, to take Finasteride because it really, really helps. Well, in my case, I did not have any side effects, which is very good. I'm very happy. That's good. That's good. Yeah, and also I also use a hair max laser comb. I don't know. Yeah, that's good. So if you don't mind, how old are you now, or how old, um, like how old are you now that you're using your finasteride? That's good that you're using it. You know what? Personally, oh, you're 16. Oh, okay, yeah. You know what? With male pattern baldness, I've noticed that it's becoming very, I shouldn't say popular, but a lot of young it's men or guys who's getting diagnosed with male pattern baldness is actually getting younger and younger. I don't know if it's related to if really stress is connected with this, or the society that we're living in, but um, honestly, it's a male pattern baldness is a genetic condition, right? So yeah, it's becoming guys are getting it in a younger age, but it's good that you started in an early stage, I should say. Actually, it's my first time hearing it from somebody like you who's using finasteride at an age of 16, because I started using finasteride when I was like 27 or 20, I believe 27. Now I'm 30. No, no, no. Sorry, 28 actually when I started using finasteride. That's good though. So is it prescribed? Was it prescribed by your doctor? What about you, Jubes? Are you using finasteride too? I bought it on the gray market. Okay, I see. And you don't have any side effects, you said? Because usually, finasteride is a prescribed medication, right? In Canada, like here in Canada, we cannot buy finasteride um, elsewhere. We have to get it at a specific pharmacist um, with um, with the prescription from the doctor. And if you don't mind, where do you live right now? That's good that you don't have side effects. So where do you live right now? Which country? Yeah. So Jubes, I think your husband might need it at an early stage, no? Kaya lang, the only problem is maybe your husband might not get this, the hard, you know. Oh, you live in Europe? Oh, nice. I wanted to go to Europe too. Where in Europe specifically? So what dosage of finasteride are you currently taking right now? Oh, no, 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 that's fine. That's fine. Don't worry. Yeah, I live in Canada. No, 5 milligram is, I think it's too big, no? 5 milligram is not for hair loss. 5 milligram is for um, a medical condition called benign prostatic hyperplasia. It's for an enlarged prostate. So um, that is, I mean, if it's, I don't know, but 5 milligram is for a different medical condition. Finasteride 1 milligram is for hair loss. Yes, 5 milligram is, I'm so sorry to say this, but 5 milligram is not a medication for hair loss. You might get side effect. Okay, I mean, I've seen a lot of my patients taking 5 milligram, but this 5 milligram is for a prostate problem, meaning those guys that have, or those elderly men that have enlarged prostate, they cannot pee. So they are given 5 milligram, and this is for enlarged prostate. 1 milligram finasteride, that is for hair loss, not the 5 milligram. No, 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 that is not true. No, no, that is not true that 5 milligram is more effective because of the higher dose. No, the cause of benign prostatic hyperplasia and hair loss is the same. They're both caused by DHT, but the dosage is different. 1 milligram is called propecia, and 5 milligram is called proscar. And at your age, 16 years old, and you're using 5 milligram, I will kind of discourage you from using the 5 milligram because it's for your safety, right? So that's why I'm saying it's very important to see a doctor, because the doctor would prescribe the 1 milligram. And you said that you've been taking the 5 milligram for 3 months now. So just to be on the safe side, I mean, finasteride, you have to take it forever. And you don't want to be taking 5 milligram forever because you might have, it can change the level of your PSA antigen that is to detect for prostate cancer. Okay, so yeah, I think don't take the 5 milligram. It has to be 1 milligram, just to be on the safe side. Okay, I want you to be safe with the finasteride. So um yeah, 1 milligram is the dose. 5 milligram is for a different medical condition. Yes, and also if you can, I highly encourage that you speak with your doctor first, because before prescribing 1 milligram, your doctor will check your scalp and your hair, and also your doctor will do a blood work on you. I am not familiar with that medication, pyrilutamide. Is it for hair loss also? Okay, so yes, actually, I'm kind of I did a I read about the pyrilutamide earlier. Actually, it's still not approved yet for androgenetic alopecia. For male, it's still on a study. So as of now, this medication hasn't been approved yet for hair loss. But since you've mentioned it, I'm gonna do a reading on that. And actually, when I searched it, there's not a lot of information, but I think it's on clinical trials right now. But as of now, we only have two approved medications, or three rather. Two for one is finasteride 1 milligram, that's for male, and also minoxidil. We have 2% and 5% solution. And also for women, we have the spironolactone. Yeah, topical as of now, the only approved topical medication for male androgenetic alopecia is really minoxidil. You can buy the 2% or 5% solution. Oh, that's good. So I will do a research on that, and maybe in the future I can also do a review on pyrilutamide. But thank you for that information. I would take note on that. And I know it's very interesting too. So yeah, be very very careful when using the 5 milligram. Okay, just to be on the safe side. I'm not going against your thing, but you're still young, and seeing your doctor is very important, because you know what the doctor will do is they will check your blood. When they check your blood, they will see if you have if you're missing or you have an imbalance. Like, say for example, from blood checking, they can also see if you have problem with your thyroid, or if you're anemic, or certain lab values may be contributing to your hair loss. So it's very important to see a doctor. I cannot see a doctor. Oh, okay. Well, I'm pretty sure that there are family doctors, and it doesn't have to be from a dermatologist. You can go and see your family doctor. He would be able to assess your hair and your scalp. Oh, I see. So, okay, let me tell you, if the reason is that the doctor would not prescribe you the medication, probably your hair loss is not related to male androgenetic alopecia, if I'm not mistaken. Because yeah, so it could be from a different reason that we don't know. Like, some people, they have hair loss because of thyroid. They also have hair loss because of anemia. Um, and they have hair loss also because of nutritional deficiencies. So finasteride is not always the medication for hair loss. Sometimes when you have nutritional deficiency, you don't have enough vitamins, they'll prescribe you vitamins, and eventually hair grows back. Not because I don't have male pattern hair loss. Yes, I know. No, I mean, they won't, because I am too young. Yes, even for myself, I was very surprised when I see when you told me that you're taking 5 milligram for finasteride. So for hair loss, 16 years old. Um, yeah, which I totally understand your doctor. But you know what? Let me tell you that there are also other ways to promote hair growth without using the finasteride. If you don't have like so much hair shedding, then the best thing that you can also do is maybe try some I don't know, maybe like topical first, or maybe manage your stress or things like that. That's why, you know, it's really really important to be diagnosed properly by the doctor. I use laser, honestly. I use laser for my hair, and I do have it. I don't know if I have it here. Let me share it with you. And this laser actually really helped my hair a lot. So this is the oops. So this is the laser that I am currently using right now. So this is a soft laser. It's called Hair Max Ultima Laser 12. So it has 12 lasers, if you can see. So there you go. So what it does is oops. So this is the laser. So you just have to run it on your hair for like um, 15 minutes, 8 to 15 minutes, and then you stop. So this laser actually really really helped my hair a lot. So maybe you can try considering something like a laser, or things like that. In terms of shampoo, there's really no specific shampoos for hair loss. Yeah, so this is my support treatment. I used it yesterday, so I'm not gonna use it today. And yeah, it really helped my hair on top of my finasteride. So I am also using an AR degrader called UT34. That's really interesting. You know a lot, eh? You're actually teaching me a lot of things also. So what is this? Is this the UT34? Is this like a medication or something that affects the male hormone? Tell me about it. Okay. Mm-hmm. Yeah, I'm not. I've never heard of it. It's not. I've never heard of it in medicine. I've never seen, but in my workplace, it's very common to only prescribe finasteride, dutasteride, and also spironolactone. Oh, okay. You're applying it topically. Okay. Wow, you're actually using a lot for your hair, eh? Just be very careful with the thing. Also, try to monitor yourself for any adverse reaction. But that's very interesting. Beauty 34. By the way, thank you guys for coming into my live video. Yeah, it is risky. It is pretty risky that you have all this. Be very careful, okay? I don't want you to have any adverse reaction or any side effects. You're a very young guy. Thank you guys. I think I have 3 viewers right now. But yeah. So if you guys are currently taking the medication or medication finasteride or supplement for your hair loss, um, share it here and we're kind of going to discuss about it. But mainly, this channel is my experience with finasteride 1 milligram. Oh, okay. So you've done a lot of research. Hmm. Okay, interesting. Yeah. Okay, Juves, are you still there? Have you guys tried the thing? Are you guys currently using a hair loss shampoo? I'm currently using a Korean hair loss shampoo, but if you guys have any different, I wanted to try something different. I am seeing Venus hair on my hairline. Will it regrow? Venus hair is a baby hair. So I think that's a good sign that you're having a Venus hair. Nizoral. Nizoral is a shampoo. Nizoral is a shampoo for dandruff. It also has an antifungal properties and regenipure. Oh, nice. Okay. I will be doing some more of my hair loss update videos maybe soon. So if you guys wanted me to do some review on a different topic on hair loss or skincare, just leave me a comment and sunscreen. You know what? Try a thing. Like currently, I'm using the Japanese sunscreen, like a waterproof. I love waterproof sunscreen, right? And I did a video on that. You can also check it out, Jubes. But I know you love sunscreen. I don't use those creamy sunscreens that those creamy ones, the thicker ones. So I don't use that. I love the Japanese one, the Sun Bears. They have the regular one and they also have the cool one. And I'm gonna bring some when I go to the Philippines because beach. So what happens if you skip a day of finasteride? Well, if you've been taking it for like for 3 months and you've already seen regrow in your hair, skipping one day does not really make you lose your hair instantly. Nothing really, but with finasteride, you have to take it every day to see much more effect. Yeah, Jube. So sunscreens, I love using Japanese sunscreens. The Filipino sunscreens that I really love is the Bello one. You know, the Bello Essentials with the whitening and also the spray that I got from Philippines. So I bought like three of them. I think the price is like 499 peso. So I really like that. Nakakatawa naman to. Nasa live chat na nga, ka-text pa. My update on finasteride, well, as you can see, I have full thickness of my hair right now. And yeah, I'm happy with it. Been taking for almost 3 years now, so I'm still continuously using it. But thank you for asking. I know. Nag-appear ba agad nung nag-live ako? Are you satisfied with your current hair or trying to introduce things like Dutasan? No, no, no. I'm good with my hair right now. I'm satisfied with my hair right now with finasteride. Um, the Tasteride, it's a medication for prostate also, but I don't think it's still it's used for hair loss as of the moment. No, no, hair transplant. No, I wouldn't consider getting a hair transplant as of now. I'm happy with my hair. I think with hair transplant, you have to be like with in a certain areas you have to be like really bald. No, no, no. For me, the only really as of now in medicine, the only approved medication is finasteride and minoxidil. So I'm not really planning to go and go into other hair loss products if it's not approved to me by my doctor, because it can cause harm than good. And our body can change very quick with certain medications, so it has to be well monitored by the doctor. And there are some cases where even finasteride have side effects of like depression or pain in their area, so I have to be very careful. That's good. It's good that you know the information. Oh, okay. I wanted to do a the if cancer is related to finasteride. Although there are some documented thing that finasteride causes cancer or prostate cancer, it's actually the data is still pretty small. I mean, yeah, but I want to do a research on that soon. Jubes, kumain ka na? Guys, follow me on my Instagram too. Oral minoxidil is not really oral minoxidil is a actually what do you call this, is a medication for blood pressure. It's just that during those times when they did the oral minoxidil, when a patient was taking oral minoxidil, there was a significant in hair growth, so they tried to see if it actually works for topically, and it actually worked for hair loss also. So oral minoxidil is a blood pressure medication. So, but it's not to be used for hair loss with oral medication. Only the topical one is for hair loss. Well, topical is the one that is topical is the one that causes of vasodilation. It's believed to cause vasodilation in the blood vessels, increasing blood flow to the hair, which then promotes hair growth. But with oral minoxidil, is actually to be used for blood pressure. It lowers your blood pressure. So um, yeah, actually, even with oral medication, I haven't seen oral medication used in blood pressure. Even topical minoxidil can cause adverse reactions or side effects, and most commonly is itchiness. It can also cause dizziness or palpitation in the heart. So topically, the topical medication does not always mean that you don't get any side effects. It's just the side effect can be seen slower or later on, unlike the oral medications. So still, um, be mindful of that. Sorry guys, I'm eating my dinner. I haven't eat yet. I haven't eaten anything yet. But right now I'm eating I'm having, what do you call this? Cucumber. Hey! Wing skyscraper, how are you? Thank you for your messages sometimes on my videos, eh? Oh my gosh, good timing because you've always been so late. I'm just joking. So what's up? I know. Sorry kasi nung last time medyo magkaiba kasi tayo ng oras. I mean our mag-English na lang ako kasi may isa na um, for some viewers they wanted to also understand. But anyways, we have time differences in the Philippines and here, so I always it's really hard to connect with some of the thing with some of you guys. I'm so sorry. But anyways, uh, I'm going to Philippines this October finally, and it's my first time to go to Davao. Okay, I'm from Batangas actually. I'm from Mindoro, so it will be my first time to go to Davao. So my friend actually lives there. Still waiting for significant result of my hair. Oh, yes, good. Are you currently using finasteride, Weng? Oh, really? So it's my first time going to Mindanao. So I'm excited. Okay, so yeah, actually, two of my cousins, myself and my friend here, and also my Japanese friend, will be going to Davao City. So we're gonna eat some durians there, and I might do some videos and stuff like that. So I'm pretty excited. But thank you so much for all the comments you posted on some of my videos. Surigao. If only I can, right? Because in the Philippines, can you guys buy finasteride? Can you guys buy finasteride? I mean, over the counter, even without doctor's prescription. Jubes, are you there? Yeah, you have to get it with prescription because I've actually some there are some people they sent me a message in my Instagram. Um they're telling me that they bought a finasteride. I said how? They said just like I don't know over the counter or something or pharmacy. But I don't know much about the pharmacy in the Philippines because I know certain medications you can buy it in the Philippines, but I mean you can buy them without doctor's prescription. And for me, I'm like, oh, you know, oh, thank you. Okay, my Instagram. Actually, you can check my go to when you go to my YouTube channel, you can check it in the about section there. My I think my Instagram is linked in there. And I've watched your thing too. I watched some of your videos also. Thanks. Yeah, usually I just post some short videos in there or things that I use. Instagram is Instagram. What else can you really post in there? So how's your hair condition right now? I think you're also using finasteride if I'm not mistaken. Oh, thanks. I know. Actually, I've been getting like few acnes lately, but I was able to clear those things out. Yeah, it's winter here, so usually I get acne during summertime when it's hot, and yeah, because my face gets oily. But so far, um, it's cold. It's like -10, so I'm okay. That's good though. Are you using a thing like minoxidil or supplements or things like that? Guys, don't forget to share my YouTube channel also to your friends and families who also have the same interest in skincare and hair care and nursing care and things like that. I really love doing hair care and skincare in related to nursing because I think nurses they have a lot to advise in terms of proper skincare and hair care also. I'm on the first week of using topical minoxidil and finasteride. Oh, okay. Yeah, usually you'll see the result after 3 months. Because in my case, I started seeing result after 3 to 4 months of using finasteride. Minoxidil, I didn't really use minoxidil. I don't have to. It's just that it's very hard to comply with the time because with minoxidil you have to actually use it or apply it twice a day, every day. And that's hard for me because I work 12 hours a day. And sometimes I work night shift. And I don't want to be going to work with an oily hair or oily scalp, right? So I'm okay with finasteride. Anyways, I did have a good result with finasteride, which I'm very happy. And yeah, this was my problem before, this area over here and this, but I'm happy now. I'm still using my hair max laser comb. So yeah, sometimes when I'm bored I just use it, just to help reboot my hair follicles, and it's a good support also for my finasteride. But yeah, so I'm gonna be bringing this in the Philippines when I go, so I can use it at night. Yeah. So oh yeah, this is a laser. So you can see. Can you see? Yeah, it's a laser. 78 pesos per piece. Grabe naman yun. Talaga ba? Well, dito din naman eh. Dito din naman. I mean, mahal din naman dito. Like yung 3 months ko, I think nasa 100, I think $100. So it's like around 5,000 pesos. Yeah, dito din mahal because finasteride 1 milligram is actually a cosmetic medication. Okay, so but yung 5 milligram na finasteride is actually I think kung may insurance ka covered 'yon kasi ano siya, it's more used for medical condition. But 1 milligram ng finasteride is really a cosmetic medication. I mean, you can live without your your hair, right? So but because oh, by the way, Weng, she's my cousin, Juve de Gracia. I mean, her husband is also wanted to use the finasteride or inquiring for finasteride, but he doesn't know the price. So she's asking if 78. Mahal nga, no? Baka naman pwede kayong bumili ng isang ano na, like good for 6 months or something. But the only problem is baka hindi tumigas. Alam mo na. Di ba may side effect daw yung ano, di ba it's actually in the medication, one of the side effect of finasteride is erectile dysfunction, but less than 2%, so it's okay. So paano yun pag hindi na ano, pero ano naman yun, it's unlikely naman. He's still young, so I wouldn't worry about it. And the only time you have to stop taking the finasteride 3 months before you, if you're planning to conceive. Yeah. Jubes, 54 minutes. Yeah, so it's good. So Weng, are you how's your first week of using the finasteride? 78 pesos pala, grabe. Hmm. Have you guys tried like any hair loss supplement or things like that? Or hair loss shampoo? I don't know, that you guys are currently using? Oh, I see. Well, actually, the topical melatonin, the result was okay. Um, I did not see any result with topical melatonin. It's just making me very sleepy. It's actually good if you wanted to sleep. If you wanna sleep quick. But okay naman siya. I mean, inaantok lang talaga ako with taking this medication. Yeah. Yeah, antok na antok ako. Alam mo yun, yung pagising ko sa well, hindi ko naman siya na-experience instantly, but after siguro on the third month, grabe, antok na antok talaga ako. Sabi ko, I mean, paano ko magagamit to everyday? And then, syempre, may work ako the next day and stuff. So, actually, nangyari sa akin na may work ako, and then I used melatonin that night. Oh my gosh, I was feeling so groggy. I was like so sleepy. Grabe. Pero in terms of like yung parang nagsha-shiny yung hair mo or for itchiness, okay siya. It's good. Did you guys have did you guys had breakfast already or lunch? I think it's 8:34 now in the Philippines, correct? Mhm. Guys, thank you so much for coming into my YouTube live. Oh, intermittent at this time? Oh, okay. That's not bad. That's not bad. I don't usually eat like after 9, and then I resume eating like tomorrow around 6 before I go to work. Yeah. So you're on your 1 week of finasteride, eh? That's good. Well, good luck for you. I hope that minoxidil is good too, actually. But be careful. Sometimes minoxidil can cause like palpitation and low blood pressure, but it's unlikely because anyways it's topical. But just watch, just kind of monitor yourself. I see. Oh, okay. Okay. That's nice. Ako, honestly, when I went to see my doctor and asked about the minoxidil, he said that if I am to use minoxidil, make sure to use the 5% foam. Kasi the solution one, the liquid one, has more, what do you call this, has more side effects than the foam one. And then the foam one gets absorbed better. Which one? The topical minoxidil? Oh, okay. The oral minoxidil is for blood pressure, pampababa ng blood pressure 'yun. So topical is much more effective kasi direct siya sa scalp mo, and it's actually it what do you call this? It's direct siya sa hair follicles mo. So it actually um, affects the hair follicles because it's a vasodilator. So pinapalaki niya yung blood vessels so you'll get more blood flow sa hair. Whereas I think sa oral, it's also the same thing. But with the oral, really, the focus is for blood pressure. Yeah. And that's the approved medication for that. Thank you so much, Wenge, for coming in here. I will end this live pretty soon too. So I might do a live next week, maybe, at like on the same time also. Gusto ko nga kulayan yung buhok ko. Like I wanted to color my hair, but the thing my mom was saying like, no, it's okay, you know, because sometimes hair coloring can destroy your hair. So might as well not. I'll leave it black. Maganda naman pag black yung ano, yung hair color. Tsaka pag nagkulay ako, baka mag-dry lalo. Lalong masira yung buhok, di ba? Kasi dati brown yung ano, French crop na haircut. Oh, really? Yeah, kumapal na nga yung hair ko because you know in Toronto right now, still some establishments are closed. So it's hard to get an appointment. So yeah, but I wanted to think. Okay, let's talk about hair supplement. Actually, some hair supplements I'm really not convinced in using. You know, just eat the right food, vegetables, fruits, and actually you can get a good support from eating healthy protein, vegetables. But hair supplement, I'm kind of like in 50-50 whether it actually works, unless if you're really deficient in vitamins. For example, after seeing your doctor say, "Oh, you're having hair loss because you're deficient, or you don't have enough vitamin B or vitamin D," then that's fine taking supplement. But hair loss supplement, you know what? Don't even bother buying hair supplements. It's not there. I don't know. For me, I really just take vitamin D, vitamin C, and zinc. Those are recommended to me by my doctor. So I'm just telling you guys, if you guys are planning to buy any hair supplements, talk to your doctor first. Kasi really, there's not enough evidence to support that if you take hair supplement, then you'll grow your hair. Even with shampoo, 'di ba? Some shampoos they have, it says on the bottle, it says, "Oh, hair growth, it will regrow your hair or it blocks DHT," things like that. Don't believe that. Really, it's not true. There's no such thing as shampoo. Yung shampoo, like even herbal shampoos, that when you apply, it blocks DHT, it lowers DHT. Kasi you know DHT is it's a strong hormone that attacks hair follicles. There's no way the shampoo can inhibit that or can stop the DHT. You have to take finasteride. That's the only approved and more evidence-based medication to control DHT, not by shampoo. So a lot of these shampoos are misleading, I should say. Yeah, business lang. You know, business, right? They'll say like, "Oh, you'll regrow your hair and this and that." But if you wanted to look for a good shampoo that helps support hair growth, I would say use something. Head and Shoulder is actually very good. Okay, you know what? Ketoconazole. Ketoconazole is a shampoo for dandruff. It's antifungal. You know what? What's really, you're right, Nizoral. You know what? Ketoconazole is an approved the anti-dandruff shampoo. So actually, using ketoconazole or Nizoral helps to get rid of those those fungal causing inflammation, yung pamamaga ng hair follicles. So if you use a Nizoral, it actually helps your hair to grow better. and healthier. So they're saying that Nizoral and also shampoo like Head and Shoulders, those anti-dandruff shampoos are actually really really good to promote hair growth or to support the your hair. But those herbal shampoos like biotin, collagen, I did a video on the biotin for hair growth and stuff like that. But don't even bother. Biotin, it does not regrow or does not prevent your hair from shedding. Biotin works if you take it as a supplement, but only if you are deficient in biotin. But biotin, um, most of the people are not deficient in biotin. So hair loss related to biotin deficiency is rare. So there's no really, I mean, hindi na siya common ngayon na mag-hair loss ka gawa ng biotin deficiency. So if you eat like meat, vegetables, they're rich in biotin. So really, um, there's no such thing as taking biotin supplement to promote hair growth. That's just business. And also biotin is pretty made it's pretty dangerous to take because sometimes when you take biotin supplements and you see your doctor for a blood work, sometimes it changes the lab result of your thyroid or even for troponin level for your heart. It changes that, so be very careful with using biotin. So the best shampoos are of course the ones that you like. So yes, hi Rembrandt Cruz, how are you? So yeah, the hair feels weak minsan pagka may dandruff. Totoo 'yon. Because the problem is if you have dandruff, may naka-cover sa ibabaw ng hair, 'di ba? So kapag tumataas siyang ganon, of course, your hair cannot grow faster with if you have dandruff. So imaginein mo yung land, halimbawa may lupa and then meron kang pinapatubong plants and there's like a lot of big rocks in there. Syempre they don't grow well, 'di ba? But try to clear out those rocks and give all the proper support and then the plants will grow better. So same thing. Yes, creatinine is if you have higher creatinine, it also indicates of a kidney problem. So be very careful. Guys, thank you so much for joining my YouTube channel. I really really appreciate that. And you know what? I'm starting to do a live streaming every week. Maybe at the same time also cuz last time I did a live and I felt so sad because I couldn't meet some of you guys and they're sending me message saying like, oh, I missed your live stream, I didn't have a chance to ask questions. So I will do a live streaming every week just to give a chance for everybody to give their questions and things like that. Is that okay? But I will be discussing still finasteride and based on my experience with finasteride. So if you guys have questions in related to if you're planning to use finasteride or side effects or things like that, you guys can always ask me. So guys, yeah, sa shampoo, maganda, it's good to use those shampoos with herbal, but don't expect that it's a miracle and it will grow your hair. Always remember that herbal shampoos are support. Okay, support siya. Okay, it does not promote hair growth. It will not regrow your hair. Um, it will not block the HT. Still, finasteride is the key medication. For female is spironolactone. So, yeah. 'Di ba merong may shampoo sa Philippines na anong tawag dito? Herbal siya eh. It's endorsed by one of the celebrity. I saw it. It's herbal. Can you guys give me the name of that shampoo? It's endorsed by um, Gary V. Bye, Wang. Thank you so much for coming. Don't worry, I'll do some more live streaming, and I'm hoping to see you there. Yes, Novu yon. Actually, Novu is it's a herbal shampoo. It's good. It's a good support for your hair with your finasteride. So combining Novu and finasteride is good. So try considering that one. It's also pretty good for your hair. Thank you, Weng. Thank you so much. Rembrandt screws. Let's check Novo Hair. I think Novo Hair. Yeah, Novo Hair is good. I've seen that. Oh, no problem. Yeah, go and check out my Instagram. Thank you. I'm just reading about the Novo Hair. Yeah, so Novo Hair actually has like different kinds of herbal thing. It has horseradish leaf, Indian gooseberry, vitamin B5, biotin, aloe. Aloe is good for anti-inflammatory. Biotin does not really work. Hyper nigrum, black pepper, virgin coconut oil. Ew, coconut oil, hindi ba ano yun? Medyo malagkit sa muka, ay sa muka, sa buhok. Lavender, rosemary. Actually, there's a lot of studies with rosemary. Um, Rosemary ingredient for promoting hair growth. It's also anti-inflammatory. It acts like a minoxidil. So they did a studies comparing minoxidil and rosemary. They found that rosemary, after a few months of using rosemary topically, it actually improves the hair density and it helps to regrow hair. So there is rosemary. They also have the conditioner one. Oh, it has malunggay. Malunggay is a sulfur. It's very good. It's a very good antioxidant, right? Oh, it has Centella asiatica too. Acacia, peppermint, and it has lavender. Interesting. Distilled water. Okay. Okay, guys. Anyways, I'm going now. I'm gonna close this live. Thank you guys again so much for coming in, and I will try my best to do another live streaming next week. So, guys, if you have any further questions, you can always leave a comment in one of my videos for skincare and hair care, and also you guys can also leave me a message in my Instagram. Anyways, guys, thank you again so much for watching, and see you guys again on my next live. Anyways, guys, thank you so much. Bye bye.